Welcome back to Wave Listings Live. Joining me now is Dr. Alex Emerson of Advanced ENT and Allergy. Dr. Emerson, it's a pleasure to have you on Listings Live.
Happy to be here.
Now, first and foremost, we have to get the elephant in the room out. Dr. Emerson and I went to high school together.
We did.
I couldn't believe it when I saw him in the green room before here, so it really is awesome to have you on the show here on Listings Live. Today we're talking about food allergies, food intolerance. A couple of questions about that. What is the difference between a food allergy and food intolerance?
Yeah, so a food allergy, whenever you're talking to a doctor or an allergist, everybody says I'm allergic to, something that doesn't agree with them. But in medical terms, a food allergy is a reaction. It's mediated by the immune system. So for whatever reason, the body decided they didn't like a certain food, has made antibodies against it, and so that's what drives the symptoms with the reaction. And food intolerance is a little more of a looser term. It's not by the immune system, it's mainly by metabolism or digestion, and the symptoms can be a little more variable than an allergic reaction.
So you mentioned the body's reaction. How is that different based on those two different things?
Yeah, so food allergy is going to be much more immediate, quicker onset. You're going to have symptoms that people think of, I ate peanut butter and I had an allergic reaction, hives, some swelling, can have wheezing, some GI upset, vomiting, diarrhea, and then in more severe cases, throat closing and low blood pressure. A food intolerance is going to be a little more delayed. It's kind of dose dependent. The more I eat with a food, the more symptoms I'm going to have. And a lot of it is GI symptoms, bloating, some diarrhea, just some abdominal discomfort.
So what are the most common food allergies? How severe can the reactions be, and what do people need to know? Maybe, especially if they're unfamiliar with some of the allergies they may have and it pops up.
Yeah, so the top 9 is what we think of for the common food allergens. So milk, egg, wheat, soy, tree nuts, peanuts, fish, shellfish, and then sesame is a new one within the past few years. And so, those reactions, they can be, mild with just a little bit of hives, so the more severe anaphylaxis. And, people typically do develop them in childhood. Milk, egg, and the tree nuts, peanuts are more common, but adults can develop it too. Eggs, or fish and shellfish are more common in adults. So it can happen anytime, but the thing to watch out for is kind of those symptoms that are consistent with an allergic reaction. And
they can be pretty confusing, I would imagine.
Yeah.
So, how do you tell? I mean, obviously you mentioned some of the symptoms, but I imagine there's also a lot of overlap there.
Yeah.
Is it more important to know if you have an allergy? Is it more important to get it treated? If you have an allergy versus an intolerance, how does that work?
Definitely important to get a food allergy treated. Right now, unfortunately, we don't have any cures for it, but avoidance is key in knowing what your triggers are. Intolerance, it can cause a lot of discomfort, but luckily it's not going to go on to a severe reaction like anaphylaxis. So if you're ever curious, am I allergic, talking with your primary care, come to see us in the office. We can do testing for those food allergies, those type of reactions, if the history is consistent with that. And intolerance is a little bit harder to pin down because there's not great testing for it, and it's more kind of keeping a food diary of what your triggers are going to be.
So an allergy, there are like black and white tests to be able to tell whether you have it or
I wouldn't say black and white, but there is testing that, if it's positive and the history is right, we feel more confident in saying this is an allergy. The skin testing that we do won't really pick up more on those intolerances, and it's more hearing the history and kind of that food diary people keep in that.
So can you have an allergy that turns into an intolerance? Can you have an intolerance that turns into an allergy? Can they exist at the same time?
Typically, one doesn't change into the other. They're kind of two separate entities. You definitely can have, they're two different processes, and you can't have both in the same person. So it's just really looking out for those different symptoms.
So let's say you believe that you have either food intolerance or a food allergy. What should they do? What does that process look like? What do they need to do? How can they get treated to just live their life maybe a little more normal?
Yeah, so can talk to your primary care and kind of outline what's been going on. They can help guide you. Come in and see us. We're happy to talk with people as well and guide things there. If people are really worried about potential allergy or intolerance, eliminating it from their diet and avoiding it until they can get some guidance. With intolerance, it's kind of eliminating it for a few weeks and then introducing it back after some time and seeing if those symptoms come back, and that's kind of how we test for it. More with kiddos, we don't recommend doing any elimination until you talk with your doctor, just because we want those kids to get those nutrients they need to grow like they need to.
I know a lot of people who are have some food intolerance that they really enjoy eating this stuff or drinking this stuff that causes the food intolerance. And they're always like, well, you know what, like I'm going to get a little sick, but you know, it's worth the joy it brings me.
Exactly.
Is that a bad idea? Is that okay? I mean, what are your thoughts on that?
I think, you know, you're a grown adult. You can make your decisions. With an intolerance, the thing is you're not going to go to that severe reaction that can be life-threatening. So it's going to cause discomfort, you know, and it can be dose dependent. So if like lactose intolerance is the common one that people think of, if you eat a little bit of ice cream and that's enjoyment and it's worth having some stomach upset, by all means go for it. But if it's going to really interfere with your life, you know, eliminating it is a reasonable step too.
But it's not going to cause like irreversible damage.
No, it shouldn't cause irreversible damage.
So let's let everyone know how they can find you, how they can find everything that you guys offer at Advanced Allergy and ENT. What does that look like?
Yeah, so if you have questions about your allergies, whether it's environmental, food allergies, you can visit our website. At advancedentallergy.com. You can schedule there, or you can give us a call and schedule there as well. We're kind of all over the city. Our main office is off of Breckenridge.
I see the number on the screen there as well, 502-272-1002. You can call that number, get signed up. You can talk to Dr. Emerson next week.
Yep.
Next week. And you can try to figure out some of those problems. We've got 30 seconds left here. Tell everyone why they should come to Advanced Allergy and ENT.
Yeah, we're the only practice in town that's got both ENTs and allergists. We see a lot of overlap between the two. And so it's an easy way to kind of get a comprehensive care. It's easy for the ENTs to refer to me and back and forth, and we're all in the same system. We see each other's notes. So, I think it's a great spot for people to come.
And Dr. Emerson is a great guy, so if you do end up seeing him, I feel confident that you'll be happy with what you got. That's all we got today for Wave Listens Live. Make sure you're visiting advancedentandallergy.com. We'll see you back here tomorrow on Listens Live. Then, see ya.